in terms of yoga and the brain is because your body and your brain work better when they're clean.
Even if it did fail, I knew I could always go back to corporate and find a job.
Teaching cafeteria workers who work so incredibly hard, teaching them about handling fresh produce, how to get more fresh produce into the schools.
You need to tell people, bring a coffee to Coffee and Crystals.
But sometimes you need an intervention. You know, you need a surgery, and that's okay. You get your surgery, and then you use all these other modalities in the Ayurveda to prevent things from coming back.
Hey guys, you stumbled upon Coffee and Crystals. I'm Katie, your motivator, your host, your hostess, and on this podcast, I am sharing a ton of information. And not only have I been highly caffeinated for a couple of years, I have knowledge of over 500 hours of yoga teacher training. I have been in the corporate world for over 15 years, so I will be your business coach. We'll talk about self-help, beauty, all things wellness and crystals. And in every episode, I am inviting you into my heart. And honestly, this adventure is pretty cool that we're going on together. We're going to meet some of my gurus, the wisdom of mentors and friends and family members. It's a good time. So stay hydrated, pour yourself a cup of coffee, and let's dig into today's episode.
Fill that uses quartz. Because it has.
I like a quartz. I have a quartz around here somewhere.
It has good wear resistance.
Okay, I can see that. And I think it's like a cleansing agent. Makes sense.
I didn't know that.
Yeah. Let's take a quick break before Finley throws himself at the glass. Hey guys, thanks so much for tuning in to another episode here with me on Coffee and Crystals. I hope that you're already following the show on your podcast platform of choice, but if not, please take this moment right here, right now, and follow the show. By following the show on your platform, it helps the show grow, and with growth, I can spread more wisdom to inspire and support mental health around the world. Today on the show, you're going to meet Dr. Asemi, who lives in LA. He is a dentist and founder of Catalina Dental in Redondo Beach, California. He has owned his own practice since 2022, which is also the year that I met him. More on that later. He is 30 years old, and trust me, just listening to him on this episode today, I promise you it tugs on your heartstrings a little bit. Great entrepreneurial advice, offers valuable dental hygiene tips, and after listening and editing this show, I really feel like I'm more mindful about my teeth and dental care. Fun fact, Dr. Asemi was the first guest to record at the studio who was allergic to my dog, Finley. So you might hear a couple of distant dog cries in the background, but don't worry, Finley is fine. He just was not too happy about not being a part of the recording, and let's get into it. Quick commercial break to share with you this new dog clipper that I just got off Amazon that's not only going to save you a ton of money with the groomers, sorry groomers, but this is also going to give you that quality time with your pet. Honestly, this is the first time I've ever given a pet a haircut, and he looks pretty good, and this is very easy to use, regardless what Finley tells you. It's only $25.49, and I am dropping the link for you in the show notes. I've been hyping you up for a while. I've been asking you to be on this show for a while, but the community knows about you. And let me tell you why. So the first time I met you, I lived in West Hollywood, and everybody thought it was nuts that I was driving to Redondo Beach. I forget his name, who my dentist was before you, but I liked him. You know, he always was giving facts. I love a doctor that is educating you, and he was just like a teacher. So I'm why are you driving to Redondo Beach? Anyway, I'm chatting with your hygienist, and we're catching up, and then I can feel your energy behind me, but I don't know it's you yet. And she's like, oh, by the way, we got a new dentist. You have a new dentist. And I was kind of after all you're dropping that I have a new dentist. I was a little rude, I'm not gonna lie. And then I hear you be hello, Miss Cronister. I swear to God, it was like Mufasa. I know why people get chills from people's voices. Oh, well, hello. No, but for real, I've seen what you've done at that place, and I already drove an hour to go there because I loved everyone that worked there, and it just keeps getting better and better.
I appreciate that.
So yeah, I want to bring entrepreneur spirit to this show. So I feel like you got a lot of that going on.
Absolutely.
Tell me about buying your practice. That's so freaking cool.
Wow. What an introduction. So this practice went up for sale by the owner's wife. I never met Dr. Phillips.
Dr. Phillips, that's what his name was.
But apparently he was the nicest guy ever.
He really was.
And his wife and daughters are still patients of mine.
Love
And
that.
they're the sweetest little family.
I love that.
So I bought it. I kept everybody on board. I was like, this is obviously an amazing team. You know, Debbie, your hygienist, has been there 35 years.
I love her. She used to have, or does have a son that used to live in my neighborhood.
Oh, yeah.
So we talk about
Small world, yeah. And then I have another Debbie that also works there for another 15 or 16 years. My assistants have been there for decades. So it was
And
a
I
really
just made up a
well-established
bill.
practice.
Apparently I had a tab with you guys from 2021. And I was like, it's taking you guys this long to get me paid up? It's a good thing I paid before you got here.
Well, I do appreciate that. I don't keep tabs on it.
That's my
manager's job.
It was like a random $200 from 2021 or something.
Oh, really?
I don't know. But anyway, go on.
People sometimes bring up like them canceling their appointment, or you know, they'll talk to me about the money that they owe, and I'm like, guys, like, I'm not looking at that. I don't like.
I figured,
I don't take it personally.
Yeah, I mean, I had like been paid up. It was just like some random like lapse of insurance that happened. But anyway, I love all of them. I've been like seriously, like I have been driving over an hour to see this
I'm
place
honored.
for a while.
I'm honored. Yeah, sometimes people will underpay or overpay because insurance is reimbursement, right? So I don't know. I don't fully understand
like that. Me neither.
all the
I
insurance.
honestly didn't even have time to ask questions. I'm like, here, take my money.
So I bought the practice, and then I kept everybody on board. In fact, I gave everybody some nice raises and said thank you for your loyalty.
I love that.
And then slowly started just investing into the business itself. I wanted to make it beautiful. I wanted to make it my own, and having the best technology and the best equipment and the best labs was really my philosophy from day one. I told my team, I was like, listen, anything you guys need, here's my credit card, take it. We will invest in it. You need a new chair, a new computer, screen, whatever. Like, it doesn't matter. I want you to have it, so at the end of the month, you don't come to me with an excuse. Oh, this is why we couldn't succeed. This is why this happened. No, you have everything you need, because you need the tools of success. If you don't have the tools of success, you'll never be successful.
I love that. All right, we already have a tweetable moment from Dr. Asemi. When did you know that you wanted to be a dentist?
That's a good question. You know, in middle school, I met a dentist that was doing amazing in life. In fact, I met her on the ski lift in Tahoe.
Love me some Tahoe.
Yeah.
I lived there in 2020. It was like everyone was complaining
It's
about how
gorgeous.
awful their experience was. I was good.
It's gorgeous.
But anyway.
It's heaven. And, you know, I met this young dentist that was doing amazing. She was working 3-4 days a week. She was like, I have great work-life balance. I ski, half the week, and the other week the other part of the week I'm working. This is something you should look into. And that was like a 5-minute conversation, and I was like, okay, great, So then the universe kind of kept pointing me into this direction of dentistry. I met, a cousin of mine at a family party that was a dentist, and he told me to come to his office, check it out, shadow him a little bit, and I did. I loved it. And then in undergrad, I started a club on campus called Volunteers Around the World.
Okay.
We did some fundraising. I put a team together, and we went to the Dominican Republic for a couple weeks and did pro bono dental work.
Wow.
And that was the defining moment, because I actually got my hands wet a little bit, and I was like, okay, if I could do this here in Dominican Republic, in this ragtag clinic, that
ragtag, what does that mean?
It was basically an open air, broken down church. And it was over 100 degrees, and we brought all of our supplies and laid them out on tables. Analog x-rays that we're developing ourselves. Think about just the absolute cheapest, clinic that you could put together, because we were working with the local dentist there, and the local community put this thing together for them. And I loved it. The patient was super appreciative. We were playing music, and they brought food for us,
Oh my gosh,
and
that's
they were
awesome.
extremely grateful. And I was like, if I could do this and have fun and enjoy myself, then absolutely, like I could be a dentist. Like I would love to do this.
I love that.
And then I just came back full throttle and kept moving forward.
And you're young. Did all this pretty young.
I'm 30.
Yeah, that's awesome. Yeah, I love that. I feel like something else that is really cool about you is you mentioned work-life balance, that, you know, the first person kind of pitched that to you, but you do seem to do work and life balance really well. Like you're always traveling, but it also seems that you're like continuing the education and studying. So tell me a little bit about that. Even on your bio on Instagram, it says like ICOI and like all these starts. Like, what does all that mean?
So, you know, I think one of the problems that dentists have is that they don't invest early on in their career. And I recognize the fact that I know that I don't know. And I was like, okay, well, how do I get into the know? And I was like, okay, let me look up all the best dentists and what do they know, and let me take their courses. And their courses are really expensive, in the thousands of dollars. Some of them are in the tens of thousands of dollars.
Yeah, I believe it.
But you come back and immediately on Monday you're implementing what you learned the week before or the 2 weeks before.
Awesome.
And it was the best investment I made. And it gave me the ability to grow much faster, do better dentistry, and ultimately deliver better patient care and be a better boss for my team as well.
Yeah, I love that. So even since I've been going since 2022, I have noticed like just some add-ons. Like I almost got Invisalign with you guys. Like I was like sold, but then I just like had all these trips and had to keep canceling and never rescheduled. But like you do like cosmetic dentistry as well, right?
Yeah, my focus is mostly on implants and full mouth reconstructions.
Okay.
I have an associate who is amazing, Dr. Aria Asemi, and she does, you know, a lot of veneers as well as Invisalign cases and orthodontic type of cases, as well as just, you know, regular bread and butter dentistry that, you know, patients broke a tooth or, you know, they have a tooth missing. There's a ton of different options.
I also feel like your social media is kind of wild. Like the things that you're showing, like I don't know what you can say, but like, are you dealing with some like crazy cases sometimes? Like you had some wild cases? Because some of the things that you show, it seems like people come to you when like some trauma has happened in the mouth.
Yeah, so we do quite a bit of marketing, and my marketing is really directed towards people that need full mouth reconstructions. You know, they have 3-4 teeth left in their mouth, or all their teeth are loose, infected, you know.
Sounds painful.
It is, and it's a disability for them, really.
Yeah.
Because they can't smile, they can't eat, you know, they've been struggling with dentures and root canals and partials and all this stuff that, you know, we don't think about because we're young and we have great teeth. But for these people, you know, and much of it is really genetic. And some of it can definitely be environmental, but they need a full mouth of teeth to move on with their life. And basically, they can come in, we remove all the infected teeth, clean out all the infections, place implants, and they walk out same day with a full set of implant retained teeth that they can chew with.
I think that's amazing.
While they're sleeping, you know, and that's the key thing here.
And the recovery?
A few days of soreness, really.
Okay, so what is like one of the biggest cases you had? Is that what they would be called, cases?
Yeah, no. I had a patient that every tooth in his mouth was infected and loose, and this is a very regular thing, right?
Yeah.
Okay. You see them on my feed, right?
Yeah, I know. When I first started following him, I was like, this is like not anything I want to see. But then I'm like, wow, what's he up to today? You're a good TV personality.
and I don't show like any of the bloody stuff or any of the gory stuff because people don't want to see it.
I feel like I saw something that was like a little bloody.
Yeah.
Maybe that was the beginning.
Yeah, maybe early on, and then my brother's like, guys, like. Nobody wants to see this.
You got checked,
like,
yeah. I felt that way when I first saw something. I was like,
this is intense. Well, of course, from my perspective, I was like, guys, like, look how cool this is.
I was like, he's half Batman.
So I took a tooth out, and the pus lay squirted across the room. And you can think about, I mean, that guy was living with that for years. And that seriously affects your health. I mean, that's just pus that's leaking into your bloodstream constantly.
This is definitely something I wanted to get into with you. So I grew up with my great-grandmother, and we were really poor. She took on my sister and I when she was 62. I was 2. She was 3. She was, actually, did I say? I think she was 62. Anyway, so we were on a lot of like government health care. So the doctors that we went to, like, it's just like what we could, you know, whatever we could do. But I don't remember a lot about my doctors growing up, but I do remember my dentist. Like, I've always had good dentists, and I know that he did a lot of work for us as kids under the table. We were almost probably like his charity project, my grandmother. But I do feel like I had a lot of issues when I was a child, but I think it was like directly correlated to stress at home and like my diet. So do you see a lot of that, or is that just like an upcoming like theme that you have or that you see?
Diet's a huge part of it, but genetics are also an enormous part of it. I mean, I have patients, and maybe I shouldn't even say this, that they legitimately never floss, and they're in their 90s, and they have no cavities, no gum disease, no issues. And then I have other patients that are brushing and flossing. They use a water pick.
Dentists tell me like, you need to floss more. I'm like, no, there's no way. Like, I do it after every meal. I was like, okay, I guess I could do it in between meals, but like I've been told that before when I feel like I'm really good at it. You probably have told me this before. It's awkward.
Yeah, and some patients, you know, like their teeth are good regardless almost. And some patients, you know, regardless of how well they do, they always seem to have some type of problem. Or, you know, unfortunately they've had bad dentistry done already, so stuff is breaking down and has to be repaired. And part of it is also, you know, just dental materials break down over time because the mouth is a very harsh environment. And fillings are normally plastic, the ones that are, you know, tooth colored at least. And those can debond and they can break down over time. And, you know, especially if you're rough on your teeth and you're opening bottles with it, or if you're grinding your teeth at nighttime, it does some serious damage.
Yeah. It might have been your office or, you know, somewhere recently. I was definitely, yes, it was with you. And I just never got one. I did a lot of grinding, but it was always like in really stressful times in my life. So just like thinking about like in yoga, so I have 500 hours of yoga teacher training and I've traveled the world, like, and I study yoga still too. That's like awesome. Similar to like you were saying before we got recording that you like to continue to learn things and take it back to the office on Monday. But I do think that the more I learned about yoga and like was studying with nurses and a lot of chiropractors go to yoga school, I just started like the epidemic in yoga is like text neck, like a lot of cervical spines because we're all leaning forward and typing. Do you feel like there's an epidemic in the mouth, that like a theme too that you've been seeing? So with like grinding, like an up level of stress and mental health have anything to do with what you're seeing?
I'll say the worst thing for your teeth is probably acidic stuff.
Okay, so coffee.
Coffee can be a part of it. I know in the Persian community, a lot of people like really sour stuff, so they'll bite into lemons or limes, you know, or, you know, a lot of people will even. Water. But a lot of people, like, you know, especially when they're drinking, they'll bite into a lemon or lime, and then they'll take their, you know, for their shot.
Yeah.
Right? But that is really corrosive to your teeth. And in the short term, you don't see it, but then, you know, your dentist looks at your teeth, and the back side of them is just, there's no enamel left.
And the enamel, does that grow back, come back? No, so that's something that you would be able to get. Well, the only way to really fix it would be to add a filling material type of it, right? Which is not the greatest thing because it will break down and debond over time, or to basically put porcelain on top of it. Gotcha.
Via a crown
so
or
it's kind of like
veneer.
A crystal. We got a crystal organically on the show. Is there any type of like crystal used in any of the like what is it's quartz?
There is quartz used in certain type of filling materials. There's a filling material called Sonic Fill that uses quartz because it has.
I like a quartz. I have a quartz around
Yeah.
here. So where are you from?
Excuse me, just south of San Francisco.
Okay, so you're a Cali guy.
Yeah.
Hence the surfboard in your office.
Yeah, I do love to surf.
Cool. I'm scared of surfing. I've tried it in Costa Rica, and the guy was like, "What are you so scared of?" I was like taking a private lesson. I was like, "Sharks." He's like, "Sharks? You got to be scared of the crocodiles." I was like, "All right, I'm out. Keep the money." Like, what the fuck? Like, I don't know.
Crocodiles?
Yeah, that's what he said in Costa
Saltwater
Rica.
crocodiles, huh?
Yeah, I mean there are signs on the beach like crocodile, and I'm like, that's wild. Like, I don't need to be where the crocodiles are. Like, they seem. I mean,
feel like the chances are low, though. You know.
I know, but I don't know. I'm like
high enough for you.
I don't know. I wanna be cool and I wanna be a surfer, but that's got to be like kind of spiritual and like on the water. Do you do that often?
If when the weather is nice, yeah, absolutely.
And you can't right now on Cali beaches, right?
Why not?
Because like all you hear about is like how dangerous the water is. And to be honest, I took my sister and my cousin to Malibu last weekend, and I stepped on an oil pile. I was like, oh my god, it's not fake news. There's like oil everywhere.
Yeah, we're surrounded by a lot of different poisons.
Yeah.
At a certain point.
True. So
you
poisons.
can just go swim anyways.
I was like, that wasn't exactly the topic of what I wanted to ask you, but like toxicity in like the dentist industry, is that something that you have to worry about, or any like precautions you put in place? I know I listened to this one podcast, and he's always like talking about like how bad fluoride is, but I grew up in Florida, and I'm pretty sure they put fluoride in our water. Like, I grew up drinking fluoride.
A lot of places have fluoridated water, and my opinion is probably pretty controversial on it.
Do you mind sharing?
No,
we
no,
love
no.
a good controversy on coffee and crystals.
Here's the thing. Fluoride is good for your teeth.
Okay.
Okay, topical fluoride is good for your teeth. Even systemic fluoride is good for your teeth. But systemically, fluoride is not the greatest thing for you. I mean, there are a ton of studies out there that show that fluoride has negative effects on your health. And the studies also, it shows that it depends on what type of fluoride it is, and for sure the quantity of it.
Okay.
Me personally, I don't use fluoride.
Okay.
Because I have a low risk.
I stopped using fluoride.
Yeah, I mean, here's what I'll say. If you have a low risk of cavities and you're not getting cavities often...
So I think I have a high risk.
Yeah. Well, I mean, I don't remember what your teeth look like, but...
I'm like...
But from here, it looks like you're doing pretty good.
I mean, I haven't gotten... But I remember Dr. Phillips for you. I was like, okay, why? Because I've gotten cavities over the last 5 years. And I just remember being like, why am I getting cavities? But he told me I might be drinking too much wine. And I was at that time. So I cut that back.
Yeah, acidic stuff is going to demineralize your teeth. Your teeth are constantly in a demineralizing or remineralizing state. When you have acidic stuff, they demineralize, and then your saliva brings the pH, basically the acidity of your mouth, back to neutral over time, and then remineralizes your teeth. But if you're sipping on coffee or wine or snacking or having acidic stuff throughout the day, soda especially, then your teeth are going to be in a demineralizing state, and they're going to be much more susceptible to cavities.
Okay, so I have to rebrand because you got us drinking tea today. It's tea and crystals, guys, because my dentist said so.
Well, tea can be acidic as well.
Yeah, really? So what do we drink? What do we hold with our crystals?
Water.
That's a good one. I do say stay hydrated on the show. I thought of doing my podcast because I was in Costa Rica, and it was like after practice, right before breakfast, we were like contemplating, and I was journaling, and I had my little coffee and my little crystal by my yoga mat, and I was like, I'm going to start a podcast, and I'm going to call it Coffee and Crystals.
It's a great name.
It is a good name.
I love it.
There's a bunch of, there's actually some other Coffee and Crystals out there, but I am at the top when you search it, which took like a year and a half. We got to the top of the Google search, right? Exactly. I have really great guests. Okay, back to your roots. So I met your mom.
Yeah?
She was at your practice once.
I didn't know you met my mom.
Yeah, I was like,
that's
this
awesome.
is kind of funny that I met your mom. You don't remember?
I did not know you met my mom.
It was like one of the times when I was supposed to be getting that mouth guard that I haven't really been grinding, by the way. So
Good.
I'm going to be back in the next couple of weeks, so we'll see. But your mom was in town, so are you close with your parents? Your mom, your dad, they're still in the picture? Okay, and you mentioned brother already. You were with him for brunch today. Cute.
Yeah, I mean, my parents come down and visit every few weeks.
Oh, awesome.
Yeah, I really like them to come down and hang out. I'm trying to convince them to move down here.
They should, because they're still in the Bay Area.
Yeah.
Okay. So that's why you went to Tahoe a lot.
Exactly.
Okay. I get it. When I first moved to California, I lived in the Bay Area. I kind of moved around a lot to try to afford where I was going to live.
Yeah.
But I was like on Fillmore Street in San Francisco. I lived in Vallejo, which people talk smack about Vallejo. But I used to take that ferry, and they would do coffee in the morning, wine at night. That's probably why I have so many cavities. But yeah, okay. So you're close to just one brother?
Yeah, one older brother. He's 6 years older than me.
Okay, awesome. And what does he do?
He's in finance.
Okay,
and
awesome.
venture capital. Yeah.
Okay, I need a finance guy on the show. We'll keep that in mind. So, have you heard of Ayurvedic medicine? So I'm not like certified in Ayurvedic medicine, but
Gotcha.
it is a way, it's like a healing. And I just remember in one of my 100 hours where I was learning about Ayurvedic stuff, one of them was to make sure, like, as a yogi, every morning and every night you clean all your orifices. One of them being your mouth. So I think I think I just kind of like got into more of like things all my life that I wasn't doing, like tongue scraping and like taking the time to like really clean my orifices. So have you heard that phrase before?
I have.
Okay. So talk to me about this. Like, what are things that people can do to like weekly check-ins, daily check-ins, other than like flossing, tongue scraping?
Oh, I'll tell you, I can only speak on one orifice.
Okay.
To begin with.
Okay. Right. We'll just go on that one. The mouth.
I mean, really the best thing you can do is, in this order, is first floss, then brush, then use a tongue scraper, and rinse and gargle with some warm salt water.
Okay.
You know, that's a very natural way to clean your mouth without any harsh chemicals and alcohols. I mean, some people, they love mouth rinses, and some of them can be good, but the problem is the ones that are alcohol-based tend to dry your mouth out. And if your mouth is dry, bacteria will grow faster. So your saliva has a lot of good stuff in it that help kill bacteria, neutralize bacteria, and help remineralize your teeth, right?
Okay.
So the problem is when you get rid of saliva, you have a lot more problems. A perfect example of that is patients that start using medications that cause xerostomia, aka dry mouth,
Okay.
are way more susceptible to cavities. And to take it a step further, patients that have radiation treatment in their head and neck, their salivary glands get destroyed, and then they will go from having no cavities to looking like they have meth mouth in a matter of a couple years, because saliva is that important to maintain your oral health.
So my grandmother, it's funny, I feel like I'm like learning more about her now that she's no longer living. But I just remember being a small child and her being like, "You don't feel well, do you?" And I'd be like, I don't know. I was probably always like, "Yeah, take me out of school." And I just remember she would always be able to tell from my mouth or like from my breath. And then she would like take me to the doctor and they'd be like, "Yeah, she has strep," but I wouldn't even call it out. She would.
Interesting.
Right?
Yeah.
That is interesting, but that must have been like saliva, like
Grandmas have a good sense.
grandmas know.
Yeah, grandmas know everything.
They know. Yeah, she was awesome. So do you like,
just to expand on that for 1 second.
Please do.
Is warm salt water also decreases your viral load by 33%. So gargling warm salt water will literally decrease your chance of having COVID and other flus and viruses. Because if you think about it, and there was a Japanese study on this that came out, if you think about it, that you get exposed to somebody that's sick, and then you don't get sick for a few days. Usually, that virus is growing in your nasopharynx or your oropharynx, basically the back of your throat.
Okay.
So if you flush all that out with warm salt water, which is basically, it's high osmolarity, so basically it'll pull out all the fluids from your throat and your nose, then the likelihood that you actually get a cold or COVID decreases, as well as your chance of spreading it will also decrease.
Interesting.
It's a fun fact.
I don't think I've ever had COVID. Maybe I just,
Wow, knock on wood.
I know, right? Watch me get sick. But I've trained for the marathon this year, the LA Marathon. I didn't end up running it, but I did hit 20 miles.
Nice.
But I got really sick and I thought it was COVID. Like I didn't get sore from running 20 miles, but I got I basically needed a lung transplant. Like I was not really. That's dramatic. I just got really, I thought it was COVID. I got flu-like symptoms. And all I was really doing to get better was gargling with hot salt water. Because again, my grandmother used to always tell me that. And it would make the world of a difference.
And it really works.
It really works. Another hot tip. Easy tip, y'all.
Easy tip.
I'm sure that's in Ayurvedic medicine too. Are you into holistic healing at all? The vibe in there in your office just feels like good energy, good healing.
I appreciate that. What I will say is that your mind is very powerful. And if you believe that you're sick, then you will make yourself sick.
I believe that.
And it's hard to practice dentistry in a way that, is holistic or kind of down that path, but it does make a difference if you have a positive mindset and you believe that you're getting better and you're feeling better, then your body will react accordingly. I have some patients that they always think something's wrong, and I'm like, listen, I thoroughly looked at all of your x-rays. You're doing excellent.
Yeah.
And then I have some patients on the other end of the spectrum that they always feel like they're doing great, but they actually have some problems that need to be addressed,
Yeah, interesting. I mean, obviously I believe in all that woo-woo stuff for sure. One of my clients does an energy healing called brain integration. And I just know, and I've worked on her social media and with her business for over 8 years. And I definitely have seen teeth, and tooth decay and all that correlation to brain dimension, brain fog, and all that kind of coming up, and just research that I've done for her social media. So I do think that, obviously it's all correlated, everything's connected, but have people started, I guess the question is, have people gotten any type of brain dysfunction and you think they also had decaying teeth or something going on in their mouth?
There is
headaches too.
There is a very clear connection between cardiovascular disease.
That's what it is.
And oral disease. So if you have teeth that are infected and they have pus coming out, your teeth are loose, your gums are always bleeding, well, this just means you have massive amount of inflammation in your body.
Inflammation, man, it's such a killer.
Yeah, and I love natural remedies, but at a certain point, when the tooth is decayed, when you have gum disease, you need to take a little bit more invasive approach to actually manually debride and remove the pathogen that's causing it. So there's no amount of mouth rinse or no magic droplet you could put on a tooth that half of it's missing and it's decayed to the core. There's nothing you could put on it except actually remove that infection from the body, or at least debride all of the decayed tooth material out, so that we could get to a healthy amount of tooth structure and to get rid of gum disease as well. Calculus and aka tartar built up on the teeth will cause your gums to really swell up, which makes them super sensitive, and that's why you touch them or you floss them and they erupt with blood. It's not a good sign.
Yeah.
Right? It's showing an underlying issue that needs to be addressed.
Yeah. Yeah, I know. There's I feel like there was so many questions, but now I'm oh gosh, how do I get through all the questions? But do you feel, so on Coffee and Crystals, I like to get a little deep. It is a spiritual podcast. So I know, do you resonate with that word at all? Spirituality? Mm-hmm. Okay. Absolutely. So what comes to mind when you hear that?
When I hear spirituality?
Yeah.
I think one of the important things is being grateful and believing, having faith.
Okay.
I think that life goes a lot better when you have faith, because it's not only that you believe in yourself, but you believe in something greater than yourself. And it takes a level of humility to believe that there is something greater than yourself. And now whether you want to call that, God by Western religion, or you want to call it the universe, or whatever you want to call it.
I know, right? you have to be careful.
But I mean, however you want to define it, when somebody's referring to the universe, they're basically referring to God, but just a different way to define it than the West would define God.
Mm-hmm. Okay. Yeah, I think taking care of your teeth I feel like could be part of a spiritual practice for people. Like, it's self-care. It's, how you're taking care of your oral health is directly correlated.
I would actually agree with you in the sense that it's showing gratitude to take care of your body in all capacities, right? Your body is a vessel. It's your car. Mm-hmm. And if you don't take care of this vessel, then it's not going to take you very far.
Yeah.
Right? And your mouth is a big part of that, right?
What I'm getting at is I use Tom's as a brand, because I don't know, it's what's at the health food store. Is that something that you talk about with your clients, products to use? You've mentioned you're not the biggest fan of fluoride.
More ingredients than products.
Okay.
What I will say is I do like Dr. Bronner's.
Okay.
I think as a whole, they have very good
soap
ingredients.
too?
Yeah, they have soap.
Okay, I have his soap.
Yeah. It depends on what your needs are. If somebody has sensitive teeth, then potassium nitrate is something that will greatly decrease the sensitivity of your teeth.
Okay.
If you have a high risk...
a lot of potassium.
Well, potassium nitrate.
Okay, I don't know.
It's the active ingredient in Sensodyne.
And that is?
The Sensodyne is a toothpaste that decreases tooth sensitivity.
Huh.
So when people have recession, or some people, they just have sensitive teeth because they could be grinding their teeth or basically causing inflammation in their teeth for whatever reason, one reason or another, they'll have a lot of sensitivity, and anything cold will really bother them, or even hot will really bother them. If it's on one tooth, that's a totally separate issue, but when it's across all your teeth consistently, then usually you have tooth sensitivity, or you have exposed roots or exposed dentin on your teeth. So potassium nitrate will help kind of seal up the pores of the teeth.
Okay.
Yeah, whitening toothpaste. This is something actually.
Oh, I did a whitening 2 days ago.
So doing whitening.
It was like coconut.
Is different, but a whitening toothpaste is generally horrible for your teeth.
Okay.
Because what they're using.
I have that, but I have in the past for sure.
What they're using is a dentrifice. So basically sandpaper. So it's wearing through the teeth in your toothpaste. So basically they'll give you gritty toothpaste, which may remove some of the surface stains short term, but long term it wears through your enamel, which will make your teeth more yellow, because the enamel is what the white part of the tooth is. The dentin is the layer underneath that is very yellow.
Okay.
So whitening toothpaste is a no-go.
What about coconut white sort that's made with coconut?
I don't know which one you're talking about. I don't know which one you're talking about.
It's some health brand. I don't even know. I should have done better research before.
Usually peroxides will whiten your teeth, like peroxide strips. The best, is to go to your dentist and then get the one that they recommend. Crest white strips also work. I don't know their active ingredients, so I can't speak on it.
Yeah, honestly, I was just curious if there was anything. I could drop a link in the show notes.
Soft toothbrushes are important.
Okay.
Yeah.
I don't think it's soft. It's like the electric.
Electric is good.
Okay.
As long as you're not using it to scrub really hard.
No.
I'd say for people that, are brushing their teeth really hard, I recommend hold your toothbrush with 2 or 3 fingers, so that you're not able to push so hard. If you're holding it like a baseball bat, then oftentimes you're pushing too hard.
I think you're going to get people thinking now. It's almost like when I talk to people, watch your posture even when you're at the grocery store. And I think that people just need to be told that, to be like, I am slouching.
Yeah.
It's like,
which affects your mood, right? Which affects your mood.
Which does. when you're like that, then you're caving in your heart. Your speech isn't open.
Absolutely.
Smile isn't bright. Yes. Okay, well, I also, one last thing on like the spiritual realm before we kind of close up, I wanted to see if there was anything that you wanted to touch in with the listeners while you're here. But a dream, I'm like, really, my therapist is like always like, okay, what's your big dreams like? That's like part of the catch up because she loves like decoding dreams. It's like her specialty. But I know that a common dream that people have, and I've had throughout the years, is like, oh my God, I gotta go to the doctor. Sammy, I lost all my teeth. And like, it's a common dream that people have. Have you been told that before? Is that a dream that you've had before? Does this resonate with you at all?
I've never had that dream,
Okay.
but a lot of my patients have told me that.
Okay.
But usually,
so it is like something you've heard before.
But funny enough, usually it's patients that have great teeth.
Yeah, so she usually thinks it's like a high stress, like what's going on at work, what's going on in your relationships. It's like a stress thing, and like disorganization financially. So I'm like, check. But I was like, I know that that's like something that like, there's just common themes in dreams that people have. You know, sometimes you have that wild dream that like no one's ever gonna have, that's your brain. But there are like common themes, and that's one of them, like snakes and stuff. People are always seeing snakes in their dreams.
Interesting. The serpent.
Do you have dreams?
I do have very vivid dreams.
Okay, like often?
Yeah, I'm always dreaming.
Do you write them down?
No.
You're like,
I
no.
don't. I have. If it's very impactful, or if it was something that really struck me, then I will write it down.
Yeah, I think this is random thought, but I'll share it. Abundance, like a big part of abundance to me is to have a life that you can like wake up slow from your dream state. And you know what I mean? Because like I really do think that is like a really connection that we have to like the other world when you're sleeping, but your brain is still like able to imagine and dream. Like that's where everything starts, right? It's like a wish, a dream, a manifestation, and your brain is doing that, and you're doing that unconsciously when you're sleeping. So when people like have to wake up from an alarm and like start rushing to their day, like that is actually not abundance to me. I don't care how busy you are. Like I like slow mornings, really waking up from that dream state, like really kind of enjoying that transition. You know what I'm saying?
That's
so
beautiful.
dreams are really cool with me. I think
It's
can,
beautiful.
like,
I wish I could wake up nice and slow.
You don't? Are you like
I wake up and like full throttle with like
Really?
we gotta go.
So like, do you give yourself time, or are you like, because you're probably at work, like I've had appointments at like 8 a.m. and you're like already in there.
Yeah.
So you start early.
Start at 8 a.m. sometimes even 7 a.m.
Okay, yeah. I feel like you've been in there when I've had it at 8 a.m. already. So are you like, what's your morning routine like? Just like alarm off, in the shower, get going?
I wake up, put my clothes on, maybe eat breakfast, drink some water, and I'm right out the door.
Okay, so that's not abundance to me. You do not live in abundance in my eyes. No, I'm just kidding.
You know what? Like I'll start my drive off.
But you
I
probably
like
have
a
nice
quiet
evening.
morning. I like a quiet
Love a
morning.
quiet morning.
Yeah, I don't like to be bombarded with questions and
Don't talk to me unless you're handing me coffee.
You know, and I don't drink coffee, and I rarely even drink tea in the morning. Like I'm not big on
Just, like,
caffeine in
hydration.
general.
Okay, that's probably good. I mean, I'm definitely addicted to it. I'm branding myself around it.
I mean, it does feel good.
Yeah. Matcha and making drinks, like it's like a ritual. It's like a whatever. It's like a thing. It's a fix. But yeah, I'd love to hear, I mean, anything that we didn't go over that you would want my listeners to take away.
Key takeaways. I'd say the earlier you go to your dentist, the better.
Okay.
Find somebody that you trust and that you're going to actually listen to.
Yep.
And if it's a small problem, that problem will only snowball into a bigger problem by waiting. I mean, you know, we touched on this before. Is, you know, a little filling, maybe a couple $100 and 20, 30 minutes of your time. But you wait a year or two, and that now becomes a bigger problem that needs a crown. You wait even longer. It's a crown and a root canal. You wait even longer. and now you can't even fix the tooth. You need to remove the tooth and get an implant or a bridge. And really, it should have been a quick, easy fix, couple $100, and you're done. But now, you're back a few $1,000s, and a lot more pain, and a lot more appointments, and a lot more invasive. So I encourage you guys to go earlier than later and find somebody that you trust.
I mean, that truly is like good advice for Coffee and Crystal listeners, because I mean, it's like that truly when you think about anything. Like, because it can also, you said earlier, cardiovascular, heart, like you mentioned all these things that can go wrong and more expensive from the filling in the mouth, but like it can affect your other organs. It's almost like yoga. Like if your knees hurt, you're gonna overcompensate on the left or the right side, and then you won't be able to be truly balanced in poses if you like have injury. So I think it's just a good thing, good life lesson.
Here's the thing: people pay a lot of attention to their skin. That's a perfect example because they can see it. It's the most superficial thing on their body. There's skin in their hair, right?
This is definitely a whole other podcast. We were talking about this at work the other day.
Right, but their mouth, for example, if you have pus coming out of your skin, especially if it's on your face, right, and it's infected, right? I mean, or your eye, like you're going to the emergency room, you're getting that taken care of immediately. But since a lot of times you don't see it when it's in your mouth, there can be pus, or a loose tooth or an infected tooth, and they're like, oh, next week. Next month.
It's wild.
But it's affecting you just as much, if not more, than an infected eye or an infected, part of your skin or an infected wound would be. So I encourage you guys, please don't live your life with infections.
Or pus.
Or infectious people.
Yes. Yeah. That's deep stuff right there from the doctor. Anything you wanted to ask me?
What's your inspiration?
Little girl Katie. I just feel like she was super brave and very independent, and I always believed in myself. And like my great grandmother used to always, she was like really difficult when she was on this earth. Yeah. But like she's just like mean, but tired and old and taking care of two little kids. But my inspiration is definitely like to help somebody like I needed help growing up. Yeah. So that's definitely like what gets me doing stuff like this. Like definitely known for being like others hype, but the inspiration around that is like I always needed a hype man.
Yeah, I love that.
Yeah.
Let me ask you one more question. What are you excited for that's coming up?
Oh my gosh, I just feel like I don't know if I can answer this quick, but basically, have you ever heard of the idea of like the dark night of the soul and how everyone has like a couple dark nights in their lifetime? Interesting. Well, yeah, life isn't perfect. It can be a little hairy at times. Yeah. So I just pulled out of like one of my dark nights of the soul for sure. It's like a really tough last 2 years for me. Yeah. And I'm just excited that I can like feel the layers of that going away. Like I'm like feeling like myself again. I'm having fun again. I'm like able to travel again. I'm like getting my life back together. I have like a little bit of a lull. My listeners have had to hear about it for like the last year and a half. But I'm just excited that it feels, I'm feeling a little less heavy lately.
That's awesome.
Good question. What are you looking forward to? And then we'll end it. Mic drop.
I'm looking forward to doing some traveling. Yeah. This next month I'm going to be
out and about.
Yeah, I'm going to be in Colombia, Nicaragua, and Sydney in the next month. So that should be incredibly fun, and with really cool people too. So those people inspire me, and we have fun doing it.
Yeah, good for you. Well, thank you so much. We finally got you on the show. Awesome. Maybe there'll be a part 2. You know, we like to have guests back. But if you guys are watching, listening, make sure you show us some love. You can follow the doctor on Instagram. He's very entertaining to watch, very LA. So I'll put all his information in the show notes. Stay hydrated, everyone, and go to your dentist. Just not mine because I can't get in. All right, bye guys.
Take care.
That's a wrap.
You're so good at this.
I am? Oh my god.
I loved it. It was very organic. I didn't feel like I had to think about anything at all.
Okay, good.
Hey y'all, thanks for listening to another episode of Coffee and Crystals. If you want to collab and be on the show, shoot me an email. I'm also looking for partners if you're looking for a yoga instructor for a corporate event or a wellness retreat, wedding, birthday party. Let's connect. My email is TheKadieWay@gmail.com. TheKadieWay@gmail.com. Looking forward to hearing from you.